Have you ever noticed, perhaps other people or yourself, so when you smile, you see a lot of gum tissue, and it's actually called a gummy smile, and it doesn't tend to appear as attractive. Usually, things that our brains interpret as unattractive are unhealthy, structurally unsound, or functionally not in alignment with the design of how they're meant to be. So with the gummy smile, there are actually a couple of reasons why that is the case. So gummy smile, one of the reasons why there could be too much of a gum tissue showing is that the teeth actually, when they erupt, so when you're a baby, you have baby teeth and then you have adult teeth. So when the adult teeth come in, as they come in, they actually pull the gum tissue with them. And sometimes that process gets disrupted for whatever reason. There are multiple explanations. And when that process gets disrupted, then the tooth actually erupts. So a tooth erupts and then gum tissue usually moves up. And then when it doesn't move up, you actually have extra gum tissue and your teeth look really small. And then when you smile, it shows too much of the gum. So that's one of the reasons. That's called altered passive eruption. And the second reason why you could have a gummy smile or too much of a gum tissue showing when you smile is that skeletally, the part of your skull, that's called, most people call it upper jaw, but it's really part of our skulls. So if that part is located too far forward skeletally or down, then when you smile, you would actually see too much of a gum tissue showing. And the best way to correct that issue is going to be to actually do a surgery. We'll get back to that, what the solution for that would be. And another reason why you might have too much of gum tissue showing is that if you have a lip, so the muscle right here between the nose and your lip, sometimes it moves too far or it contracts too much. And it's called lip hypermobility. So your lip, actually, the muscle that controls your lip movement, moves too far up, contracts too tight. So you actually end up exposing too much of gum tissue. So then a solution for altered passive eruption, which is where when your tooth erupts, the gum tissue doesn't follow that, doesn't retract back. So the solution for that would be what's called aesthetic crown lengthening. And we can easily do that with just cutting back the tissue, exposing the tooth, and wow, it's almost like magic. There's your tooth. It was all underneath the gum tissue. It's really, really cool, amazing result. And we do that by having a board-certified periodontist work with me to be able to do that procedure easily in the way that makes a huge difference for people. The second part, where you have actually the skeletal position of the jaw too far down or forward, that is something that needs to be usually corrected by oral maxillofacial surgeon, which we don't have that at our practice, but I would work with specialists to do that. And then you actually don't need any dental or periodontal surgery procedures at all for that. So it's just the position of the jaw more of an issue. Then the third reason for why there's too much of a gum tissue showing, where the lip moves too far up or contracts too tight. And the solution for that, again, not a gum surgery, nothing to do with teeth. It's a super simple and easy way to just correct the mobility of the lip by injecting a little bit of Botox in that muscle to make it less mobile. And then we do that part with Dr. Curtis Gable. He's board-certified facial, plastic, and reconstructive surgeon. He would inject a little bit of Botox, relax the lips, so when you smile, you actually don't show as much of a gum tissue. Crown lengthening is when we actually end up cutting the back the tissue. That is an amazing procedure that makes a huge difference for a smile. And again, we do that with working with a periodontist. So we could take care of all the reasons why you show too much of a gum tissue, make your smile as amazing as you want it to be.